Hi, I'm Dr. Jodi Larson. I'm the Chief Quality Officer here at Boston Medical Center. As a Chief Quality Officer, I take it as my responsibility to ensure we consistently provide high quality, safe, equitable patient care. And we really look at every situation as a possible safety issue, whether someone files an RL safety report, calls the risk manager on call, reports an issue at the daily safety huddle. My team looks into those complaints and issues that are raised and identifies whether there's any opportunity for improvement. And then we work to be collaborative across areas to try to fix situations. And my team likes to think that, we try to fix things as quickly as possible because we're trying to fix it for the next patient that comes in the door. I grew up in Syracuse, New York, where we get a lot of snow. And I would say that my upbringing really taught me a lot about self-advocacy and being self-reliant. My father passed away when I was young, and my mother suffered some significant depression as a result. My older brother and I had to really learn to lean on each other and really advocate for ourselves and for each other. It's my mother who's had the biggest influence on my life. I think of her as incredibly strict, as well, persistent and creative at times. Whether it was when she adopted me and my brother, she adopted the debt that my dad had and his business failed, or whether she wanted me to learn how to type. She was incredibly persistent and as well incredibly resilient. When I was practicing medicine, I became the residency program director at a prior institution and was a practicing hospitalist. If there was something with the order set that didn't work well for me as a hospitalist, it was also probably inconvenient and didn't work well for the residents. So I constantly was trying to solve things to make my life easier as well as make it easier for the residents. So I ultimately got invited to more and more meetings just because I was constantly trying to improve and solve problems, and then sort of landed in a quality role, and here I am. I think one of the things I'm most proud of when I first got here in the first 6 to 12 months was instituting a daily safety huddle. So if you talk about interdisciplinary collaboration, that's where it happens. Every day for 15 minutes, 50 different areas across the hospital come together to talk about safety issues that occurred within the past 24 hours and that we anticipate might happen in the next 24 hours. And they connect with each other to fix issues and solve the problems in real time. So that's the coolest thing, that people are still coming to that and still finding that a really productive forum to solve problems in real time. I think one of the things I'm really passionate about is a term called psychological safety. I really want our staff to be able to speak up freely about any patient concerns that they have. And so I would love it if we creating the environment for our staff to speak with candor. And the way we do that is we get them no fear of punishment or retaliation if they speak up. As well, they will speak up and raise concerns if they know that things will get fixed. So that's the kind of environment we're trying to create in the quality department.